In the previous videos, we explained how metabolism changes over time, why increasing effort can backfire, and what metabolic flexibility actually means. In this video, we will focus on a question many people experience directly: why fat loss begins to feel harder, slower, and more resistant after the age of 35. This experience is often described as a slowing metabolism, but that phrase is misleading. The body does not suddenly stop burning calories. What changes is how energy is regulated, how signals are interpreted, and how the system prioritizes storage versus release. Earlier in life, energy regulation is relatively forgiving. Small mismatches between intake and expenditure are corrected easily. Fat is released when needed. Hunger rises gradually. Recovery is efficient. Effort produces predictable results, even when routines are imperfect. Over time, this balance shifts. The body becomes more conservative with energy. Signals that once promoted energy release now produce weaker responses. Storage signals dominate more often. This transition does not happen suddenly. It develops gradually, often without obvious warning signs. One of the first changes is reduced access to stored energy. As insulin signaling becomes less effective, fat remains in storage longer. Even when calorie intake is reduced, the body does not release fat efficiently. Energy becomes less available to tissues that require it. This creates an important mismatch. The body may contain large energy reserves, but it behaves as if energy is scarce. Fatigue increases. Spontaneous movement decreases. Exercise feels harder to sustain. Recovery becomes slower. These changes are not failures. They are adaptive responses to altered signaling. Another important factor is how the body responds to repeated effort. When calorie restriction and increased activity are applied repeatedly without restoring flexibility, the body adapts defensively. Resting energy expenditure declines. Small energy-saving behaviors increase without conscious awareness. The total energy deficit becomes smaller than expected. This adaptation explains why plateaus occur. The system is no longer responding linearly. More effort does not produce more release. Instead, the body tightens control over its reserves. Stress further amplifies this effect. Physiological stress increases over time due to cumulative demands, disrupted sleep, inflammation, and slower recovery. Stress hormones signal the body to preserve energy. They promote fat storage and reduce fat release, particularly in the abdominal region. This shift in fat distribution is important. Abdominal fat is more sensitive to stress signals and insulin. As stress increases and flexibility declines, fat is preferentially stored centrally, even when total weight gain is modest. Muscle tissue is also affected. Muscle is a primary site of energy use. When muscle becomes less responsive to insulin and less metabolically active, overall energy demand declines. This reduces total energy expenditure and further limits fat loss. At the same time, maintaining muscle becomes more difficult. Reduced energy availability, impaired recovery, and increased stress interfere with muscle signaling. Over time, small losses of lean mass can occur, further slowing metabolic capacity. Importantly, these changes do not indicate damage. They represent adaptation. The body is responding to signals it interprets as risk. Fat loss feels harder because the system is operating defensively, not because effort is insufficient. This explains why many people experience frustration despite consistency. The system resists further change. Pushing harder often reinforces this resistance rather than resolving it. Understanding this reframes the problem. The question is not why fat loss is difficult, but why the system is prioritizing conservation. When flexibility is reduced, regulation overrides effort. In the next video, we will examine how metabolic flexibility is lost in everyday life, often through subtle patterns that appear normal but gradually shift regulation towards storage. On this channel, I explain metabolism using medical science. This video is for educational purposes only. This is not medical advice. Always consult your physician.